Yo, what's going on YouTube, man? Such about is back again with another video, back again with another reaction. You already know what time it is, baby. And I am reacting to the day in the life of a cardiac surgeon. I know many of y'all don't know this, but I'm trying to go to medical school. And I'm also trying to be a surgeon. And I have not watched enough. Not enough. I haven't watched a lot of days how surgeons live their life, you know what I'm saying? Just a day of their life. I haven't watched a lot of those. So I just want to watch this on stream and also post it on YouTube, you know, my reaction and whatnot, and see how it goes. This might change my mind. It won't. It won't.
It's 6:30 in the morning. We're in the East Tower parking
Oh, that's easy. That's easy. 6:30.
garage at
I can do
Robert Wood
that.
Johnson University Hospital.
You know what I noticed, bro? Every single time I see like a surgeon, bro, they never look young, but they always look old, bro. Which also scares me, cause I don't want to start like doing what I love to do when I'm old, bro. I want to do it at a young age. That's one of the things that's making me a little scared, even though I want to be a surgeon for sure, right? I still have my doubts because I want to do what I love to do when I'm young. So when I'm older, I can have like other things, you know what I'm saying? But every single time I see a surgeon, like a cardiac, general, all these surgeons, they always look old as shit, bruh.
Friday, which is my normal operative day.
Shit's
And
scary.
today we will be doing 4 operative cases.
Good morning, Dr.
3 of the cases are minimally invasive cases, and 1 case is a coronary artery bypass. So COVID has really impacted how we do things every day.
Facts.
Obviously, we're all
COVID has messed a lot of people up, especially me, bruh. Can't even get shadowing hours because of COVID, bruh. Like what? Damn.
wearing masks all day, every day, not only in the operating room.
But it's better now. It's better now. I'm getting some. I got a couple of shadowing lined up right now. So finally,
Contact made after surgery is by phone. Morning. Good morning. Good morning. Patients in the room. Morning, Margaret. Once we hook up the patient to the monitors, we do what's called a timeout, which is a safety check. All right. Timeout.
All right, I am a free bit of
The timeout process that we do in the operating room comes from the World Health Organization, and it is a means to be very careful and to ensure that we don't make mistakes.
This woman is 62 years old. She has what's called aortic stenosis. The valve at the top of the heart, called the aortic valve, has become very tight over time, and as a consequence, her heart has to work extra hard to try to push blood through that tight valve. When all the blood can't go forward, it starts backing up, and it backs up into the lungs and causes shortness of breath. It can also cause chest pain because the heart's working extra hard. It can also cause lightheadedness because not enough blood is actually escaping the heart and going up into the brain.
right.
So what we're doing today is what's called a minimally invasive aortic valve replacement. So
I just love the way medicine has progressed, bro. Like a lot of things now, a lot of like procedures is like invasive, which is like great, bro. Like in the next like 20 years or so, I'm pretty sure that almost everything's gonna be invasive, bro. And I'm glad I'm gonna be part of that. I'm gonna be part of that, bro. Cause man, who wanna like? It's gonna less time, less recovery time, like less complications. It's amazing how good medicine is, bruh.
So everything else in the heart is in good working order. She'll have about a 3-inch incision on her right chest where we go between the ribs, and through there we can get in there.
I'm excited about this like surgery part, you know what I'm saying? How we just started and got right into it. But when I'm trying to watch a day in the life of a surgeon, right? I'm trying to see what he does outside the hospital. Like his routine, things he do, things he gets to do, like stuff like that.
To then replace the valve.
Okay, you can ventilate both lungs. It's a fairly straightforward case. Everything went well as expected, so I'm going to just call the family member. Good morning, it's Dr. Lee calling from Robert Wood.
Good morning, Dr. Lee.
We're all done with surgery. Everything went well. She got the valve.
That is the best news to give, bro. I'm not gonna lie to you, bro. I would love if there's a possibility that I'll be doing what he's doing right now every time I complete a procedure, bro. Man, I'm gonna be having a great day, bro. Like, getting to tell a family member that everything went as it's supposed to, bro. It's beautiful.
Valve replaced through the small incision on her right side. She's doing okay.
This is great news. Thank you so very much.
All right, we'll see you a little later, okay?
Okay.
Have a good
Amazing.
day. You
Thank
too. Bye-bye. As the surgeon, we get a lot of credit, but honestly speaking, the operation is 10 to 15% of the success of our
Facts.
program.
Facts.
It's all these people. It's everyone in this room.
Facts. That's
It's
so
everyone in the
that's so
ICU.
factual.
It's everyone on the floor. The care they give, the attention to detail.
That's also how a team work, right? Like a team will not work as it's supposed to if everybody's not playing their role right. Like a domino effect, right? If you remove one domino where it's supposed to be, and when the rest of the dominoes like fall and get to that spot, the rest won't fall no more, bro. That's how a team work, bro. Everybody needs to do what they're supposed to, or nothing will happen.
All of that is incredibly important to the success. It is now 9 o'clock. We're in the second room. This gentleman is 74 years old.
Wait, what's he doing? What's he doing this time?
And like the last patient, he has a tight
No.
aortic valve.
Okay, no
But in
replacement.
addition to that, because it's sort of been long-standing, the mitral valve is now also leaking.
Damn.
So he's a very good shape, 74-year-old gentleman. So we're obviously going to go ahead and fix his heart. We're going to again do this through a small incision on his right side. We will go in to replace the aortic valve and repair the mitral valve. So by echo or ultrasound, we can see that the mitral valve is actually calcified. So I may have to replace both valves in this circumstance, but we'll see what it looks like when we get in.
So is this gonna be an invasive procedure, or is it gonna be like an open heart surgery?
We are a very high volume center, and the importance of high volume is that there are many, many studies that show that the more you do, the better you are, and you become a major referral center. But that does not take away from the personal touches that we have with our patients and the personal relationships we have with our patients.
How's he doing?
He's good.
Is he?
Yeah, everything went well. Replaced both valves through the small incision on his side. His heart's otherwise in good shape.
Replace both valves with the same, bruh. Everything's so invasive, bruh. Beautiful.
He'll be out of the operating room
Beautiful
in about
work.
20 minutes. When you're able to go out and speak to the family and tell them that everything went well and that their loved one is doing well is always very, very rewarding. So that's one of the best parts of the job.
Indeed.
The next patient is a pure mitral valve.
Bruh, are y'all noticing like the time from one procedure to the next? But this nigga barely get any breaks, bro. He's just
the
going
valve in the middle of the heart, and in his
surgery
case,
to
it's
surgery.
leaking quite a bit, just like all these other valve issues that we've seen today.
And
if
it's
this is
funny,
left
every single thing he did today so far is all valve replacements.
alone and not fixed long term,
I like these.
the heart starts to get bigger and weaker, bigger and weaker. Aortic valve's okay. This is the main university hospital.
I'm actually gonna do like a series, right? I'm gonna react to their life of different kinds of doctors. Even though I know what I'm trying to do, I will see a different aspect that might change my perspective and change like the type of doctor I want to be in the future. Because if you think about it, right, family is very important to me, and if I'm gonna end up doing a job that will pull me away from family, bro, that's not a job for me. I'm not gonna lie. And surgery is gonna require a lot of my time, bro. A lot of my time. So I don't know. I still want to be a surgeon, but only time will tell at this point, bro. Only time will tell, because things happen, perspectives change. You know what I'm saying? But we'll see.
For the Rutgers Robert Wood Johnson Medical School. We're all faculty of the medical school, and this is where we practice. We do roughly 1,600 hearts per year, which is one of the largest programs in the Northeast. One and the right.
I can't wait to
four.
learn how to read that. Oh my god, there's so many things, bro. How to read the EKG, how to read stuff like that, bro. I'm just excited to learn that, bro. You don't understand. I'm excited to learn all that.
Bypasses. We just got in the room with the fourth case, which is a coronary artery bypass.
Wait, it also depends on when that other one ended, though. It depends on when that other one.
And
So
what we
far,
do with
but every
bypass surgery,
procedure is pretty close.
It's the one operation today that we're actually doing through a standard approach.
Okay, so what are they doing
it's
now?
the one operation, and what we do with bypass surgery, which is a
coronary artery bypass.
bypass. And what we do with bypass surgery, it's the one operation today that we're actually doing through a standard approach. She'll have an incision right down the middle of the chest. We'll take an artery from the inside of the left chest and some vein from her legs to do the bypasses onto the heart. We don't touch the blockages, we leave the blockages where they are, and we use this artery and the veins to make detours around the blockages so that blood can get to where it needs to get to. You guys okay?
Yeah, we're good.
Thank you, sir.
Peace out.
So what happens if the blockages just end up like, first of all,
Thanks,
what's
everybody.
causing the blockages? Like, what happens if the blockages, it's not there anymore, and you have like a bypass and the original, was it a mitral valve? What is it?
You guys okay?
I don't know, but it had the original one, blood flow is going through two different routes into the same destination. What would happen then?
Thank you, sir.
Peace out.
Thanks, everybody. From here, we'll go upstairs to the ICU, make some rounds on the patients we operated on earlier today. We are New Jersey's largest academic medical center. How you doing? We do a fair amount of research in cardiac surgery. I have a lab in addition to clinical research.
He's good the last few more years?
He's good, yeah. It's an institution that has students, residents, research, education, and ideal or optimal clinical care that encompasses all the forward-thinking modalities of treating patients, and we want to be on that forward-thinking innovation. So that ends our day. It's about 4:10 right now, so we've done all of our cases, we've seen all of our patients, and I think it's time to go home.
Wow, that was a good day. Everything went successfully as it's supposed to. I mean, they're not gonna show us the bad side. It's always gonna be the great side of medicine. But this was really good. Now, the next thing I'm gonna be reacting to is gonna be, what should I do? I'm gonna do a neurosurgeon. I'm gonna do a neurosurgeon next. But if you're new to the channel, go ahead and like, share, subscribe. You know what I'm saying? And I don't know. If y'all should tell me more things I need to react to, because I'm running out of things, man. I just be getting on YouTube and be like, damn, there's no more content. But I also need to go outside, bro. I need to start making more IRL content. And yeah, I'm gonna end the video right here. Adios.